what's the relationship between tobacco and non-communicable diseases?
So tobacco use is the most common preventable cause of death. The non-communicable diseases, which are largely a group of diseases which happen due to a number of risk factors, and tobacco use is the most predominant amongst them. More than 63% of global deaths are now because of NCDs, and more than now 6 million people out of that are dying due to tobacco use. So there's a huge impact of tobacco use on all the NCDs.
You've come up with an intervention called Be Healthy, Be Mobile. Can you describe it, please?
So Be Healthy, Be Mobile is a joint WHO ITU initiative. WHO and ITU are the two UN agencies which are responsible for health and telecommunication matters respectively. This initiative was taken up as part of the UN General Assembly's resolution on NCDs adopted in 2011, which sought to have multi-sectoral collaboration and cooperation outside of the health sector, because much of the health impact can come through a number of non-health sectors, including in the technology sector. So we used that understanding and expertise of this sector, and we came up with this initiative which seeks to support the governments to leverage technology to strengthen the health systems.
So where does this intervention fit in the whole world of tobacco control policy?
So tobacco control requires a whole of government approach. It requires a full understanding of the WHO Framework Convention on Tobacco Control, which is the only public health treaty under the WHO framework. It has a set of demand reduction measures. The best amongst them is tobacco taxation, smoke-free policies, bans on tobacco advertisements, and we need to understand very clearly that all of these are very cost-effective interventions, and they can easily be implemented by the governments. Now, when we look at targets and we try and achieve an agreed target to reduce tobacco consumption in society, all of these measures are extremely important. But then there is a set of people who continue to consume tobacco, 25 to 30% in a number of countries, and numbers are growing in even developing countries. How do we help them in a manner which is cost effective? Traditional ways to help people quit tobacco are quite expensive and therefore not considered best buy strategies. We've come up with mHealth solutions to change that landscape and help existing tobacco users to change their behavior. And that's where we fit in the whole tobacco control scenario.
What's the economic motivator for a country to get serious about tobacco control?
I would think the best understanding is that there is no economic gain of tobacco production, manufacture, or usage. And studies done in developed and developing economies show that the health and economic cost burden from tobacco, whether it's hospital costs, the economic losses, are far in excess of what the economic gains are, whether it's tobacco taxation or economic revenues from other sources of tobacco. There is therefore need to be an understanding that tobacco per se does not lead to an economic growth. Now what is happening is that the tobacco companies, who are very smart, have understood this pretty well, and they're reaching out to economies which did not have that understanding, the developing countries in Africa, for example. And they have reached out to target new generations to get their replacement for those who are getting to understand it better. The understanding also needs to be there in the governments that today the replacement of labor is cheaper in many of these economies. And therefore it may not appear to be an issue when there are more premature deaths due to tobacco use. But in years to come, if economies are extremely serious in raising their productivity and improving their GDPs, their labor replacement costs must be factored in. Tobacco control is a sure-shot solution to help them achieve this objective.
Thank you very much.
Thank you.